My name is Dr. Kimberly Davis, Senior Research Scientist and the Director of Community Outreach for the Center for Cancer Research and Therapeutic Development at Clark Atlanta University. I welcome you to this edition of Life Notes. Today, we will talk with our guest about gastric cancer, otherwise known as stomach cancer. The stomach is an organ between the esophagus and small intestine. It mixes food with stomach acid and helps digest protein. Stomach cancer mostly affects older people. Your risk of getting it is also higher if you had Helicobacter pylori infection, have had stomach inflammation, are a man, eat lots of salted, smoked, or pickled foods, smoke cigarettes, have a family history of stomach cancer. It is hard to diagnose stomach cancer in its early stages. Indigestion and stomach discomfort can be symptoms of early cancer, but other problems can cause the same symptoms. In advanced cases, there may be blood in your stool, vomiting, unexplained weight loss, jaundice, or trouble swallowing. Doctors diagnose stomach cancers with a physical exam, blood, and imaging test, an endoscopy, and biopsy. Because it is often found late, it can be hard to treat stomach cancer. Our host, Paulette Payne, sat down with our guest to talk more about gastric cancer. She joins us with more.
Dr. Wood, thank you so much for joining us today on Life Notes.
Thank you for having me.
And so we understand that you are an expert in the area of gastric cancer. We want to share this information with our viewers because many are living with the disease or they've just been diagnosed. So can you tell us, for those that are watching who have not been diagnosed and that might be having some symptoms, what are some things they need to look for?
So I think that a lot of patients who come in with gastric cancer or stomach cancer will have a combination of symptoms of either fullness or pain or discomfort in the upper abdomen. Usually they'll notice some sort of bleeding from their intestinal tract, either from above or from below. And then patients who have stomach cancer often will have weight loss, either from the effects of the cancer or from the inability to really eat the same amount of nutrition that they'd been used to due to the side effects of the mass.
Now, so some of the more severe symptoms is the bleeding. Right. Now, what if they're having, unusual indigestion, pain in the abdomen? Is that something they need to be concerned about?
It would definitely be something that needs to be investigated further. I think it's important to note that stomach cancer is quite rare. And there's a much higher likelihood of having something that is not cancer related. But that said, symptoms such as an indigestion that doesn't go away, or early fullness with meals, or any sort of symptom in the upper abdomen that just doesn't seem right should definitely be evaluated by a physician. The most common test that would identify gastric cancer or stomach cancer would be an upper endoscopy or a flexible camera that goes down through the mouth and looks at the inside of the stomach. And that's a safe procedure that's usually done as an outpatient.
And so once these tests are done and it is discovered the patient does have gastric or stomach cancer, what's the next part of the process?
The most important process at that point, once cancer is identified, would be to obtain a thorough staging of the patient. And most commonly what we'll do for that is do a different type of scope through the mouth that looks with ultrasound at the thickness of the tumor. The other components of determining what type of treatment the patient should have would be looking with some sort of scan to see if there's been any spread of cancer to any other organs. And that can be done through either a CAT scan or a CT scan, or a combination of other therapies that would identify whether there are any tumor cells in any other organs.
And so if it is determined that there are tumor cells in any other organs, and certainly in the stomach, what type of treatment then is optional? Is there surgery, chemotherapy?
So the best treatment for patients who already have disease that's spread outside of the stomach would be chemotherapy or a combination of chemotherapy with radiation. Chemotherapy is usually given either 2 or 3 different medicines given together. They'd be usually given through a vascular access port, which would usually be put in either by a surgeon or a radiologist into one of the main veins that drains into the heart. Through that port, usually a chemotherapy treatment schedule would be made. Radiation can be used in addition to the chemotherapy to treat any local effects of the tumor. For example, if bleeding was a significant problem, or pain, or direct involvement of any of the other organs, radiation would be a good treatment for that. Chemotherapy goes throughout the whole body and kills any cancer cells that may be there. So chemotherapy is definitely an important step in the treatment of patients with gastric cancer that's outside of the stomach.
And once they've undergone treatment, and of course they've had their follow-up appointments, what then is the long-term prognosis?
Unfortunately, patients who have advanced stomach cancer are going to have a challenging or a low 5-year survival rate. The chemotherapy gets better and better, and there are lots of ongoing research trials, both in America and overseas in different countries, where they're investigating different treatment strategies for advanced stomach cancer. On the other hand, patients with a stomach cancer that's limited to the stomach, or limited to the stomach and lymph nodes, would have a much better survival rate. They would almost always undergo a resection or removal of the stomach with surgery. And after all of the incisions have healed and after all of the internal intestinal connections have healed, then that patient would very likely have some surveillance. Every 6 months they'd have some sort of scan or maybe some blood work, along with endoscopy, or the flexible camera through the mouth to look at the remaining portions of the intestine.
Now, of course, lifestyle concern is very important among patients who are being treated with cancer. And you mentioned resectioning. Mm-hmm. How does one's lifestyle change after they've had a portion of their stomach removed?
That's a really good question, because any sort of abdominal surgery, we obviously have effects like nausea and abdominal pain. Those should gradually get better in the month or 2 after the operation. However, in the process of removing the stomach, you're removing the body's food reservoir. So instead of being able to eat 3 meals a day, for example, a patient who has a stomach removed would likely need to have 8 to 10 smaller meals throughout the day. It's very similar to patients who undergo different types of weight loss surgery, for example. Instead of eating big meals, you eat more frequent smaller meals. And because you can't fill up on as much, you'd need to change your diet to include more high protein, low sugar type foods to help regulate the intestinal tract and make sure that nutrition is prioritized.
So a healthy, productive lifestyle is possible after treatment?
Absolutely. There are definitely a lot of patients who have a stomach removal for cancer and either undergo chemotherapy treatment, or if they're fortunate, had a small tumor that didn't require any chemotherapy or radiation. And after the initial 2 to 3 months after the surgery, they're living healthy, productive lives.
And I'm sure that's good to know, and some of our viewers are probably breathing a sigh of relief to hear that. Now, I understand gastric cancer isn't as prominent in this country, but more prominent in other areas around the world. But what are some final takeaways that we need to make sure our viewers know, particularly in the African American community?
I think it's important to know that stomach cancer disproportionately affects more than would be expected certain populations in America. African American population is definitely one of those. Asian American populations and Hispanics are also affected higher than expected in America. Worldwide, patients in Asian countries have much higher incidence and prevalence of gastric cancer than we do in the West. and that is believed to be a combination of genetic factors and environmental factors. The environmental factors, believe it or not, include consumption of a lot of smoked or pickled foods. So, as a corollary, people in America that want to reduce their chance of stomach cancer, a common recommendation would be to reduce the intake of pickled foods and smoked foods. Obviously, you know, having once a month barbecue is something that I enjoy myself, if not more frequent than that. But making those things a daily part of the diet can definitely increase the risk for stomach cancer. Another big thing to avoid in order to reduce the risk of stomach cancer would be to quit smoking. Tobacco exposure definitely is involved in increasing patients' chance to develop gastric cancer and lots of other cancers as well.
So there are preventive measures one can take.
That's right.
Of course, it doesn't rule out 100%, but you definitely have a role to play in your overall health. And
that's right.
Dr. Wood, thank you so much for joining us today. I know our viewers will be enlightened and informed by the information you shared.
Well, thank you very much for having me again.
We'll be right back with more Life Notes after these messages.
CAU-TV, educating and entertaining since 1982.
Hi, I'm Makad Brooks. I play wide receiver Terrence King on USA Network's Necessary Roughness. Let's talk about a game that you don't want to play. African American men have the highest incidence rate of prostate cancer, 65% higher than white men. Even worse, we have the lowest survival rate. In fact, we are 2 to 3 times more likely to die of the disease than most Americans. It's time to go on the defensive. See your doctor. Schedule your PSA screening and your prostate exam. It can save your life, save my dad's. And that's exactly what the researchers at Clark Atlanta University's Center for Cancer Research and Therapeutic Development are working to do daily. Now it's time for you to join the team. Get it done.
Take a look under your bed. Find stuff under there? What about jobs? No? Now try your closet. Still no jobs, just more stuff? Well, you really have both. See, stuff is defined as household articles considered as a group. Sometimes this stuff is no longer needed. Wait, no longer needed? That can't be right. Because remember those jobs you were looking for? Those are really needed. And they're the stuff inside your stuff. Our job is to unlock those jobs. And it starts when you donate your stuff to your local Goodwill. Here's how we do it. When you donate to Goodwill, we sell your stuff to provide job training for people right here in your community. So just by teaming up with Goodwill, you help create jobs. And isn't that worth parting with the leftover keytar from your 80s cover band? Goodwill. Donate stuff, create jobs.
What do you think it would be like to teach? Chances are, you have no idea.
We're going to turn the lights and everybody look up.
Teachers today are breaking down obstacles, finding innovative ways to instill old lessons, proving that greatness can be found in everyday places, and that you don't need to be famous to be unforgettable. That's what it's like to teach.
This is the moment I knew. His future had no boundaries.
There are some moments only the forest can inspire. Find yours at discovertheforest.org.
We believe it's very important that we bring you information from the experts in the medical field, but we also believe it's important to bring you firsthand accounts from survivors. So today I'm joined by Ms. Annie McRae, who is a survivor of gastric cancer. Ms. McRae, thank you for joining us.
Thank you.
So take me back to the day that you received your cancer diagnosis.
I received my cancer diagnosis on Valentine's Day, which such is a day that most women want to hear something really positive. But when I received the diagnosis, I realized that it wasn't a death sentence. I right away spoke with my maker about the situation, and he gave me a calmness that is beyond understanding. And most people, when they hear cancer, they get all excited and upset and fall apart. But I was so calm. And I continued to talk with God about it. And he directed me on how to handle the situation.
And from our conversation earlier, you told me about the medical professionals that assisted you in this journey, and it sounds like all of the right people were placed in your path at the right time. Can you share with me a little bit about the treatment options that these medical professions took you through?
Okay, my primary care doctor suggested that I go to the best doctors that he knew. And I wound up at Emory University, and the doctor that was taking care of me, he told me what we're going to do is we're going to take part of your stomach, which will be 60%, because at that time I had an ulcer and had the cancer. And we're going to take 60% of your stomach, and then we're going to follow her up with chemo. So they followed up with chemo after the surgery. I did really well with surgery, and I had no difficulty. I healed very well, and they started me with the chemo.
And so before the diagnosis, before the chemotherapy, what caused you to realize something was wrong?
I have been going to the doctor for acid reflux, and one day I noticed that, okay, this isn't getting any better. The acid reflux is worse. The pain is getting more. So I thought, okay, I need to go to my gastrologist and have him to take a scope and look down in my stomach and let me know what he see. That's the only way I was going to be satisfied. So that's when he discovered the cancer. So
it sounds like you had a pre-existing condition that caused you to realize something was wrong.
Right.
And so post-surgery, post-chemo, how has life been?
Life is wonderful, I have to say that. But it's a life-changing experience. You must understand that once you have a major surgery, this was my first surgery. And so once you have a major surgery and you've had cancer and chemo, it changes your life 100%. You don't even want to do some of the things that you used to do, but then you want to do more than you did before.
And so what are some things that you decided you wanted to do for Annie after your surgery and after the healing process?
I love babbling brooks. I love waterfalls. And I was just determined I was going to walk near waterfalls and brooks and just calm in water. And so after I had the surgery and got so I could handle everything, my husband took me to the mountains. And I got a chance to see the waterfalls and just calmness. You just really, really enjoy life after a situation like that.
And so amid this peace that you have now, what joy and what benefit is it to have a network of support to see you through this process?
It is absolutely wonderful to have a support group. I have to say my husband, my children, my grandchildren, my church members, my friends, they walk with me 100%. They stayed there with me to make sure I was okay and fine. And I just, you couldn't ask for a better support group.
That is beautiful.
I'm so happy with that.
You know, and I talk with patient survivors all the time, and they echo what you say. It's important to have this network of support because there are going to be bad days.
That's right.
Then there are going to be good days.
That's right.
And then there are going to be some more bad days. So to have that support system that keeps you stable is critical. So Ms. McRae, tell us, how many years have you been cancer-free?
4 years.
And that's something to celebrate.
Yes, it is. Yes, it is.
Ms. McRae, thank you so much for joining us today on Life Notes. We appreciate you sharing your story with us.
Thank you for having me. And God bless.
To learn more about the CCRTD and the services we offer, please contact us at 404-880-6878 or via email at www.cancerinfo@cau.edu.